Hello friends, I'm Dr. Maria Morrison, audiologist. I am your expert in hearing healthcare, and I've gotten this question a lot. What can I expect when I go in for my hearing test? And I think it's important to understand that there are different types of hearing tests. So there is a baseline hearing test. At our office, we also have a hearing evaluation and functional hearing assessment. We also have a hearing evaluation for tinnitus management, a hearing evaluation for cochlear implant candidacy. So it just kind of depends. I'm going to go over your kind of basic baseline hearing evaluation. When you first come in, we're going to bring you into the room, you'll take a seat, and we're going to go over our 4-step process. So step 1 is an interview. We're going to ask you some questions. Step 2, I'm going to look in your ears. Step 3 is the actual hearing test. And then step 4 is where we go over all the results and recommendations. So in step 1, the interview, we're going to go over your medical history as well as your hearing history. So medical history, we're looking for things that could have affected your hearing in the past or impact your hearing in the future. Things like cardiovascular disease, strokes, cancer, noise exposure, things like that. And then of course we want to know, do you have a history of ear infections, any surgery to your ears? Do you use hearing protection when in loud environments? Things of that nature. Then I'm going to take a look in your ears. I might use a video otoscope like here, or I might do a regular otoscope. What I'm looking at is your external ear canal. I'm looking for things like debris, wax. Is there a growth in your ear? How does the eardrum look? Does it look like it's bulging? Is it red? Am I getting a good cone of light? I'm essentially assessing your outer ear canal to make sure it's in good working order. Then step 3, I bring you into the booth and we're going to go ahead and do the hearing evaluation. We might use inserts or headphones. At our office, we typically use inserts because it's a little bit more accurate, but depending on your ears or the test that we're doing for my tinnitus consultations, I use specialized high-frequency headphones. It's specialized equipment specifically for tinnitus testing. Just kind of depends. Again, basic hearing evaluation, we're probably going to use inserts. This test, the hearing test, has several different parts to it. Certainly when you hear a beep, 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 you're going to press a button or raise your hand. We're also going to have you repeat some words. When you're listening for the beeps, we're assessing all 3 parts of your ears, and we're looking for how soft you can hear the sounds to determine if you have a hearing loss. When we have you repeat those words, it's single words. Say the word door, say the word chair. What we're looking at is how well does your brain understand speech in a quiet environment. This is done without visual cues, without context of the conversation. We're really just testing your brain's ability to interpret what the ears are sending it. Again, untreated hearing loss for long periods of time, your brain will begin to lose its ability to understand speech. So we want to know how well your brain is doing. Then when we're done with the speech testing, we're going to take those inserts or headphones off. We're going to put a piece behind your ear. This is called bone conduction. With bone conduction, we bypass your outer and middle ear and we're going directly to the nerve. This is going to let us know if you have a hearing loss, what is causing the loss. Is it a nerve damage where a hearing aid or cochlear implant is going to be appropriate? Or is it a conductive hearing loss where we need to refer you out to a ear, nose, and throat physician? Now, depending on those basic tests, so we did pure tone audiometry with inserts or headphones, we did speech testing, and we did bone conduction. Depending on those 3 tests, we might need to do additional testing. Maybe there is a conductive component, meaning there's a difference between testing with the bone versus testing with the inserts. We're going to do what's called tympanometry. That's looking at the movement of your eardrum to determine if the issue has to do with the movement of the eardrum or the middle ear. If there's a large difference between your ears, one ear is much better than the other, we might do testing which is called acoustic reflex decay and acoustic reflex testing. This again is looking at, well, why is there this difference between the ears? Most of everything I've just discussed has some sort of coverage with insurance. Most insurance cover at least part of what I just discussed. If you have difficulties hearing in noise, we're going to do a speech and noise test. This is going to look at your brain's ability to filter out the noise and being able to focus on the speech you're trying to listen to. This is an example of what that sounds like.
He wheeled the bike past the winding road. Throw out the used paper cup in the ditch.
Now, this specific test is not covered by any insurance that I know of. It always gets denied. So that is an out-of-pocket expense for any patient who's having difficulty hearing in noise. I hope this was helpful. This kind of gives you a basic understanding of what to expect when you go in for your hearing test. Of course, after the test, we go over step 4, which is the results and recommendations. We explain everything to you, make sure we answer all your questions, and then of course talk about next steps. Maybe it's just get your hearing tested every year. We're just going to monitor what's going on. Or maybe you need to see an ear, nose, and throat physician. Maybe you do need hearing aids, or you need auditory training. Just kind of depends on the results, but I hope that was helpful. If you have any questions, please let me know and have a great day.